Ancylostoma duodenale. Ancylostoma duodenale, commonly called the Old World human hookworm, is an intestinal nematode parasite affect mostly the jejunal part of the small intestine. The parasite causes a range of disease called hookworm disease, which include hypersensitivity reaction and anemia due to perforations. Morphology. Ancylostoma duodenale occurs mainly in two morphological forms. Adult worm, it is cylindrical in shape with a dorsal bent of the anterior end, which gives it a hook-like appearance and hence the name. Its oral aperture has 4 ventral hook-like teeth, and 2 knob-like dorsal tooth. The male is provided with a copulatory bursa for the process of copulation. Egg. The egg of Ancylostoma duodenale is segmented with 4 blastomeres surrounded by a thin transparent hyaline shell membrane. Life cycle. Definitive host, human. Infective form, falciform larva. Eggs are passed in the stool and, under favorable conditions like moisture, warmth, shade, larvae hatch in 1 to 2 days and become free living in contaminated soil. These released rhabditiform larvae grow in the feces and in the soil. And after 5 to 10 days, they become falciform, third-stage larvae that are infective. These infective larvae can survive 3 to 4 weeks in favorable environmental conditions. On contact with the human host, typically bare feet, the larvae penetrate the skin and are carried through the blood vessels. They penetrate into the pulmonary alveoli, ascend the bronchial tree to the pharynx, and are swallowed. The larvae reach the jejunum of the small intestine, where they reside and mature into adults. Adult worms live in the lumen of the small intestine, typically the distal jejunum, where they attach to the intestinal wall with resultant blood loss by the host. Most adult worms are eliminated in 1 to 2 years, but the longevity may reach several years. Clinical manifestations. Ancylostoma dermatitis or ground itch. This occurs at the site where the falciform larva penetrates the outer skin. It causes intense itching which, if followed by edema and erythema, creeping eruptions or cutaneous larva migrans. When the falciform larva fails to penetrate the stratum germinativum, they remain between it and stratum corneum and wander about the skin, forming popular eruption through the path traversed. Anemia. The adult worm ingests blood. Also using their suckers they cause perforations in the intestinal wall, causing further blood loss. Lab diagnosis. There are 2 methods, one is by direct demonstration of the worm or egg, and the other by associated symptoms. Direct method. Stool examination. Adult worm or the eggs are demonstrated by doing microscopic examination of stool sample to confirm hookworm infection. Indirect method. Blood examination. Blood examination shows microcytic hypochromic anemia and eosinophilia. Treatment. The patient is given mebendazole 100 mg BD for 3 days, or albendazole 400 mg single dose, or parental pomote single dose. Prophylaxis. Wearing foot protective-like shoes. Proper disposal of human faces. Overall sanitary hygiene should be improved.